Hi, I'm Dr. Asad Khalid. I'm the Orthopedics and Sports Medicine Specialist here at Oneida Health. Thanks for choosing us for your orthopedic care. You are either about to have surgery or have just had surgery on your hand, wrist, or elbow, and this video is going to go through the post-operative instructions on how to achieve the best possible outcomes following your surgery. The first things to look out for after your surgery are the warning signs, and these warning signs include the following. Excessive bleeding or pus-like drainage at the incision site, uncontrollable pain not relieved by pain medication, excessive swelling or redness at the incision site, fever above 101.5 degrees that is not controlled with Tylenol or Motrin, shortness of breath or severe calf pain, and any foul odor or blistering from the surgery site. If you are experiencing any of these symptoms, please do not hesitate to give our office a call 24/7. If you are experiencing any medical emergencies, please go to your nearest emergency room. Pain management is an essential component to your postoperative recovery, and our goal here is to minimize the amount of pain you feel after surgery, while also minimizing the amount of narcotics used after surgery. You will be prescribed certain medications after surgery to help you with your pain. Some of these medications contain narcotics or opioid medications, and these should be used sparingly and should be weaned as soon as possible. The medication and/or the anesthesia may also cause you to be nauseous and vomit after surgery. You will be prescribed medication to help assist with this as well. You may have been given a regional nerve block by our anesthesia service before or after your surgery. This will cause the area of the surgery to be numb for about 24 to 36 hours. It is important that you take your pain medication before the numbness wears off to better control your pain. You may have also been sent home with a cryotherapy unit and a TENS unit. These are important adjunctive treatments to better control your pain without the use of medication. You can use these as tolerated. It's important that you take the pain medication as prescribed and be careful with how much Tylenol you are consuming along with the narcotic medication, as these also contain Tylenol. You should not take more than 3 grams of Tylenol in a 24-hour period. Pain is an expected part of your postoperative course and may not be completely controlled 100%. However, excruciating pain that is uncontrollable with the measures that we talked about is an issue. Please call our office if you are having pain that cannot be controlled. When it comes to icing your operative site or using the cold therapy unit you may have been prescribed, please use it as instructed. This would likely be 20 minutes on or 20 minutes off, and please do not sleep with the cold therapy on, as this can cause burns to your skin. This brings us to diet and activity. It's normal to be a little nauseous after your surgery, and if you are feeling nauseous, please start eating a bland diet and then progress to your regular diet from there. It is also normal to have a little constipation while taking your narcotic medicine, and if you're feeling constipated, please take over-the-counter Colace 100 milligrams twice a day. Please try to limit your activity during the first 48 hours after your surgery, as this is when you'll be feeling the most pain and have the most swelling afterwards. Please try to limit your activity during the first 48 hours after your surgery, as this is when you'll be experiencing the most pain and swelling. It's very important that you elevate your hand or your wrist above the level of your heart on 2 to 3 pillows to help with the swelling. And please be sure to follow any postoperative restrictions, including weight-bearing restrictions and bracing. You're probably wondering, when can I shower at this point? And the answer is day 3 after your surgery. But it's very important that you keep your incisions dry, and to help do this, please place waterproof bandages over the operative site, and we also recommend that you use plastic saran wrap over the operative site. If you notice any redness or foul drainage coming from the incision, again, please give us a call. If you have a splint or a cast, this cannot get wet. If you're going to try to bathe with a splint or a cast, you need to cover it with a bag and keep it out of water. You may have been prescribed physical therapy before and after your surgery. This is an essential component to your recovery, as they will be there with you every step of the way on your recovery after your surgery. The most common mistake that patients can make after surgery is not following the instructions we just talked about. Every instruction and every piece of advice has its own purpose, and they're all essential to helping you achieve the best possible outcome after your surgery. So this is a typical dressing for after hand, wrist, or elbow surgery. You may be placing a splint at your elbow. If you are in a splint, please leave it on until you come back to clinic. This could be in conjunction with hand surgery as well, and you will have a separate dressing on the hand, which I will take off here to show. Once you take off the dressing, you will see a smaller, clear, waterproof dressing underneath at both the hand and the elbow. The dressing at the elbow, if there is one present, please leave it on until after surgery. You will not be able to find a dressing big enough to cover that incision. If you do have one on the hand, on day 3, this can be removed to show a small incision at the palm, which can then be covered with a waterproof dressing that can be obtained at any pharmacy locally over the counter. Just place it over the incision, make sure the incision is well covered, and you can shower with this on. So this has been your guide to the post-operative instructions after hand, wrist, and elbow surgery. If you have any questions about anything mentioned in the video, please give us a call, and thank you for watching.